Welcome to Master USMLE, the podcast that gets straight to the high-yield facts you need to crush your exam. I'm Dr. Afrasiabi, and today we're tackling a topic that shows up frequently on Step 2 CK nerve entrapments. These conditions often appear in clinical vignettes, and can be the difference between picking the right answer and overthinking. So let's break it down. Fast and focused, the way you like it. Let's start with Meralgia Paresthetica, classic USMLE stem, a middle-aged, overweight patient with burning pain and numbness in the lateral thigh. No weakness, no back pain, just isolated sensory symptoms. What's the cause? Compression of the lateral femoral cutaneous nerve under the inguinal ligament. Common risk factors include obesity, tight belts, prolonged standing, or pregnancy. Management: conservative, weight loss, avoiding tight clothing, NSAIDs if needed. Easy to diagnose, no imaging required. USMLE tip: no motor symptoms. The LFCN is purely sensory. That's what makes this an easy pick in a question. This one's a must-know. It's caused by median nerve compression at the wrist. Patients? Think pregnant women, diabetics, hypothyroidism, or office workers with repetitive wrist motion. Symptoms? Numbness and tingling in the first 3 fingers, worst at night. Then our atrophy equals late-stage disease. USMLE test clues: Phelan's test, symptoms worsen when wrists are flexed. Tinel's sign, tapping over the carpal tunnel reproduces symptoms. Management starts with wrist splints and NSAIDs. If severe, nerve conduction studies confirm the diagnosis. Definitive treatment: carpal tunnel release surgery. Ever hit your funny bone and felt that shock down your pinky? That's the ulnar nerve at the elbow. This happens in truck drivers, people who sleep with arms flexed, or those leaning on their elbows a lot. Symptoms include numbness and tingling in the ring and pinky fingers, weak grip strength, can't open jars, claw hand deformity in the late stage. USMLE clue: Tinel's sign at the elbow, not the wrist. Management: modify elbow use, night splints, and surgery for severe cases. Alright, let's talk about wrist drop. The radial nerve can get compressed in the spiral groove of the humerus after prolonged compression. This can happen, for example, if you fall asleep with your arm draped over a chair, often referred to as Saturday night palsy. It can also occur with midshaft humeral fractures. Scene 2, key findings in treatment. Key findings: wrist drop, patient can't extend wrist, weak grip strength but intact sensation in the palm. Best diagnostic test: clinical exam. USMLE treatment approach: supportive care, wrist splints, physical therapy. This one's like carpal tunnel, but in the ankle. It's caused by compression of the tibial nerve at the ankle, often seen in runners, flat-footed patients, or those with ankle swelling. Symptoms: burning pain, tingling in the sole of the foot, worsens with prolonged standing. USMLE pearls, Tinel's sign at the medial malleolus. Treatment: supportive, orthotics, NSAIDs, steroid injections. And that's a wrap. Quick recap: Meralgia Paresthetica, lateral thigh numbness, no motor involvement. Carpal tunnel, median nerve, first 3 fingers, night symptoms. Cubital tunnel, ulnar nerve, pinky and ring finger, weak grip. Radial nerve palsy, wrist drop, Saturday night palsy. Tarsal tunnel, burning foot pain, tibial nerve entrapment. USMLE loves these nerve entrapments because they're pure pattern recognition. Lock these in your memory, and you'll be ready for test day. If this helped, share it with a friend prepping for Step 2 CK. Subscribe for more high-yield breakdowns. I'm Dr. Afrasiabi, and this is Master USMLE. See you in the next episode.